Hello everyone, myself Shumila Chatterjee, Sister Tutor of NSNS Nursing Institute. Today I am going to discuss a very basic topic from Fundamental of Nursing, which is therapeutic positioning and its purposes. So let's start with the topic. Now let us first learn the definition of therapeutic positions. Positioning is defined as placing the person in a correct body alignment for the purpose of promotive, preventive, curative, and rehabilitative aspects of health, or placing the patient in proper body alignment as needed therapeutically. Patients' ability to assume a position depends upon their physical mobility, strength, ease of breathing, age, and degree of wellness. Patient positioning is an essential aspect of nursing practice. Now, let us learn the principles of positioning. First, maintaining good body alignment for self and patient. Second, maintain good body mechanics. Third, changing position regularly, that is, after every 2 hourly and systematically. Fourth, inspection of pressure points during position change for early identification of skin breakdown. Fifth, follow safety measures to prevent accidents. Now, let us see the purposes of positioning. First, positioning ensures comfort, that is, positioning a patient in correct alignment keeps the patient as comfortable as possible. Second, positioning prevents decubitus ulcers. Third, positioning is very important for diagnostic procedures and treatments. Fourth, comfortable positioning enhances sleep and rest. Fifth, positioning prevents complications related to immobility. Sixth, good positioning stimulates our nervous system. Seventh, positioning maintains good skin integrity. Now, let us see the types of therapeutic positioning. Supine position, which is also known as horizontal recumbent position. It is defined as lying on the back with arms at sides. In this position, the patient is made to lie on his or her back with arms and legs straight on the sides on a flat bed. Generally, the head is rested on a pillow, keeping the neck in a neutral position. The patient's arm can be either tucked at their side or abducted to less than 90-degree angle. The patient is supported with either pillows or air cushions to make them comfortable and rest in correct position. Now, let us learn what are the purposes of supine position. First, the supine position is the most common position used in operating room. It provides excellent surgical access for intracranial surgeries, cardiac surgeries, and abdominal surgeries. Supine position is also used for physical examination of the anterior part of the body. Supine positioning is also used during assessment of vital signs. Next, let us see the prone position. Prone position is defined as lying on abdomen with head turned to the side. In this position, the patient is made to lie down on abdomen on a flat bed. To support the patient lying in prone position, place a pillow under the head, one pillow under the waist, and one under the ankle to release the weight of the toes. Arms may be above head or alongside body. Now, let us learn the purposes of prone positioning. First, prone position promotes drainage from the mouth and useful for patients who are unconscious or those who have recovered from surgery of mouth or throat. Second, prone position is used to examine spine and back of the patient during physical assessment. Prone positioning is also useful for improving oxygenation in patients with acute respiratory distress. It is also used to relieve abdominal distension. Now, let us see the Fowler's positioning. Fowler's position is a semi-sitting position with various degrees of head elevation. Fowler's position is a bed position wherein the head and trunk are raised 15 degree to 90 degree angle. This position is given to the patient with the support of backrest and pillows. However, Fowler's positioning can be classified into three types: high Fowler's position, semi-Fowler's position, and low Fowler's position. Now, let us see the high Fowler's positioning. In this position, head of bed is elevated to 90 degree angle. High Fowler's position provided to patients with difficulty in breathing. It is also used while eating and drinking without risk of aspiration or choking. Secondly, let us see semi-Fowler's positioning. In semi-Fowler's position, head of the bed is elevated to 30 degree to 45 degree angle. This position relieves tension on incision site after abdominal surgeries and eases the breathing process. And lastly, let us see the low Fowler's position. When head of the bed elevated to 15 degree to 30 degree angle, it is known as low Fowler's position. Low Fowler's position prevents aspiration during tube feeding. Let us see the uses of Fowler's position. Fowler's position is used for patients who have difficulty in breathing. Fowler's positioning also facilitates the relaxing of tension of the abdominal muscles, allowing for improved breathing. High Fowler's position increases comfort during eating and drinking without risk of aspiration. It is also used in postpartum women to improve uterine drainage. Fowler's positioning is also given when oral or nasal gastric feeding tubes have been implemented, as it minimizes the risk of aspiration. Fowler's position is also used to relax the muscles of the abdomen, back, and thighs. Now, let us see cardiac positioning. Cardiac position is also known as tripod position. It is a sitting upright position with the head of bed elevated to 90 degree angle. Patient may lean slightly forward with arms raised and elbows flexed. This position helps in easy breathing. Next, let us see the dorsal recumbent position. Dorsal recumbent position is lying on the back with arms at sides, legs apart, knees bent, and feet flat on the bed, with patient's head and shoulders slightly elevated on a small pillow. This position is similar to supine position with knees flexed and soles of feet flat on. Now, let us learn the uses of dorsal recumbent positioning. This positioning is used for physical examination of abdomen and genitals. Dorsal recumbent position is used for perineal care, urinary catheterization, vulval, vaginal, and rectal examination. Dorsal recumbent positioning also provides comfort to patient with back strain. Now, let us see what do we mean by lateral or side-lying position. Lateral position or side-lying position is lying in the left or right side, supported behind back and between knees and ankles with pillows is a good body alignment. In this position, the patient is made to lie on right or left side with both the knees slightly bent towards the abdomen, but the upper knee is bent more than the lower knee. Uses of lateral positioning. Lateral position helps to relieve pressure on the sacrum, heels in people who sit for much of the day or confined to bed rest in Fowler's or dorsal recumbent position. Lateral positioning is also used for patients' comfort and to promote lung and cardiac function. Lateral positioning relieves supine hypotension in pregnant women. Patients who require periodic positioning changes. Lateral positioning is also used for examination of perineum and rectum. It is also used for inserting rectal suppositories and flatus tube and for monitoring rectal temperature. Lateral positioning is also used for giving enema and colonic irrigation. Now, let us see what is the seams position. Seams positioning is also known as lateral decubitus positioning, which is defined as lying on the left side in semi-prone position with right leg flexed and drawn up towards the chest. The left arm is positioned along the patient's back. Seams position is a semi-prone position where the patient assumes a posture halfway between the lateral and prone position. The upper leg is more acutely flexed at both the hip and the knee than is the lower one. Support proper body alignment in seams position by placing a pillow underneath the patient's head and under the upper arm to prevent internal rotation. Place another pillow between the legs of the patient. Uses of seams positioning or lateral decubitus positioning. Seams positioning is used for rectal examination or treatments of rectal area. It is used for administering enemas and suppositories. Seams positioning may be used for unconscious patient because it facilitates drainage from the mouth and prevents aspiration of fluids. This type of positioning is a comfortable position for pregnant women for sleeping. Seams positioning is also helpful for sigmoidoscopy and proctoscopy. Now, let's come to the Trendelenburg's position. Trendelenburg's position was named after the German surgeon Friedrich Trendelenburg. This position includes lying on the back with arms at sides, bed positioned in such a way that foot end of bed is higher than head end of the bed. The body is laid flat on the back with the feet higher than the head with approximately 30-degree angle below horizontal level. Use pillow to protect the patient's head from the bed's headboard. Uses of Trendelenburg's position. This is a standard position used in abdominal and gynecological surgery. This position is also used for postural drainage, which is a procedure for draining secretion from certain segments of the lungs. It also promotes venous return. This type of positioning is also used in emergency situations like shock, hemorrhage, and hypotension. Trendelenburg's position is also provided to patients with deep vein thrombosis. Now, let us learn about reverse Trendelenburg's position. Reverse Trendelenburg's position is the opposite of Trendelenburg's position. Patient lying on back with arms at sides, bed positioned so that head is higher than foot but no flexion at waist. Uses of reverse Trendelenburg's position. This type of positioning is a position of choice for patients with gastrointestinal problems as it can help to minimize esophageal reflux. It is also provided to patient after femoral angiography. Reverse Trendelenburg's position is used during certain upper abdominal surgeries to shift abdominal contents downward. Now, let us see the lithotomy positioning. Lithotomy position is defined as lying on back with knees flexed above the hips and legs supported in stirrups. Lithotomy position is used for examination and diagnostic procedures of pelvic organs. This position is similar to dorsal recumbent position, except that the patient's legs are well separated and thighs are acutely flexed. Legs are usually placed in stirrups. Drape the patient properly. Fold sheet or bath blanket crosswise over thighs and legs so that genital area is easily exposed. Expose only during examination or procedure. Uses of lithotomy positioning. Lithotomy positioning is used during vaginal and gynecological examination and surgeries like hysterectomy. This is the classical position for women under labor during vaginal delivery. This type of positioning is also used for vaginal douche procedure. Now, lastly comes the knee-chest positioning. Knee-chest positioning is a type of positioning where the patient kneels on the bed with thighs vertical and chest resting on the firm pillow. The head is turned to one side and hands are flexed around the head or on the bed. Thighs are straight and lower legs are flat on bed. Knee-chest position is used for rectal and vaginal examination and as treatment to bring uterus in normal position. The patient is draped to allow visibility of the rectal area and coverage of the rest of the body for warmth and modesty. Uses of knee-chest position. The knee-chest position is used for gynecological and rectal examination and surgeries like lumbar spine surgery and for repair of vesicovaginal fistula. It is the position used as first aid treatment for pregnant females with cord prolapse under delivery occurs. This positioning is the primary position for sigmoidoscopy. This positioning can also be used during administration of enemas and suppositions. So that's all for today. I hope everybody has understood today's topic of discussion, which is therapeutic positioning and its purposes. Thank you, everyone. For more informative videos based on nursing practice, do like, comment, and subscribe our channel.